Dr. Amy Morgan, who works for the Department of Family Science at University of Maryland College Park. And our presentation today is called Breaking the Cycle, Building Family Resilience in the Shadow of Incarceration. So I'll go ahead and turn it over to Amy. I have put our website in the chat. I'll do that again. If you have any questions, I'll also put my email in the chat for any follow-up. This webinar is being recorded and it will be posted on our YouTube page afterwards. So thank you, Amy. Do you have any issues with sharing your screen, or it looks like your co-host?
Great. I'm gonna try sharing right now.
Okay, and I have spotlighted you as well.
Great. Will you continue letting folks in? Because I'm not sure that I'll be able to
Yep,
see. Okay,
I'm
great.
here for tech support, so I have the
Okay.
chat open and I'll be managing that as well.
Okay. Apparently, I was the one that needed tech support a few minutes ago. I appreciate you being here.
No problem.
Okay.
I can see your screen.
Excellent. You can see my presentation, not my notes, correct?
Yep.
Okay, great. All right. Well, thank you everyone for being here. I'm honored that Dr. Chan invited me to do this. This is my main area of work. I'll introduce myself a little bit. And I imagine by the flyer, you have a sense of what this presentation is going to be about. But I'm going to introduce myself and then talk a little bit about what we're going to cover. So, as Jade mentioned, I'm Amy Morgan. I'm an assistant professor in the Department of Family Science at the University of Maryland School of Public Health. I'm also a licensed marriage and family therapist, and so I've worked in community mental health as a community provider, and right now I'm in private practice here in Silver Spring. I research couples, families, and incarceration, and I often get the question why. It started in my community experience. When I worked as a provider in community mental health, I was working with families that were just cycling in and out of incarceration or criminal legal settings. And I found myself really frustrated with the limitations of what I could do in one room. And I felt like there needed to be much more work in sort of the advocacy and policy, but also the research arena. Right now, there are very few interventions for families coming out of incarceration, and there are zero evidence-based interventions for couples, for people coming out of incarceration. That's kind of uncommon to be able to say there are no interventions in this area. So it really speaks to the need. I'm currently trying to work on a couples-based intervention now. So that's a little bit about me professionally. On a personal note, I can't see everyone's screen, so I'm not sure who here I know, if anybody, but on a personal note, I'm a big fan of carbs, bagels in particular, dogs, podcasts. I spend a lot of time listening to podcasts and fall in the DMV. And if any of you, I assume a lot of you are in this area, it has kind of felt like a fake fall this past week compared to the 100+ degree weather we've had, and I have been absolutely loving it. So I'd love to know, I really don't have a clear sense of who all is here, especially because I can't see many of your screens. Could a few of you just put in the chat sort of your role, where it is that you're coming from? I'd love to see that.
Amy, we do
Yeah.
have a question in the chat. Will we be able to share the presentation slides afterwards?
Yes. Yep. I have a link and a QR code at the end.
Sounds perfect. And this webinar is being recorded, so it'll also be posted on our Madeline Rupta YouTube page as well.
Excellent. Thanks, Jade. Okay, so just thank you everyone for, yeah, keep putting your roles, your locations in the chat, suicide prevention specialist, child development. Yeah, so there's a really big range of what people are doing, which is excellent. Lots of folks in Maryland, Pennsylvania, Delaware, West Virginia. This is really great. Thanks, everyone. It's really nice to meet you. And again, thank you for being here. So in anticipating that a lot of different folks would be here from different roles. I do touch later on sort of individual implications. So if you're working with people one-on-one versus programmatic implications if you're working people from a program perspective. So let's talk about what I'm going to cover. If you saw the flyer, these will look familiar. I'm going to talk about incarceration as a social determinant of health that creates multi-generational risk. So actually, I would argue incarceration is one of the most critical overlooked social determinants of health just because of the web of risk that comes along with it. So I'll talk about key risk pathways through which family incarceration increases substance use disorder and behavioral health vulnerabilities. But because I was trained so systemically and I'm a systemic therapist, I can't just touch on these things. I'll also talk about sort of the broader system things, policy, economic disadvantage, et cetera. A lot of the work I do is really focused on resilience. And the reason for that, I mean, there's a number of reasons for that. I think we should generally be really resilience and strength-based focused in the work that we do. Um, but also, a lot of what's out there already is very deficit based. There's a very strong stigma that is associated with people involved in the criminal legal system, and that has permeated through programming, through research, a lot of deficit based language in thinking about and working with families impacted by incarceration. So, a lot of the work I do is really focused on resilience and promoting protective strategies. So, I'll talk about that. I'll cover practical approaches for prevention and treatment programming, and then I'll spend some time talking about trauma-informed and strength-based frameworks. So if you're not familiar with trauma-informed care, I'm sure many of you are. I'll briefly cover that. Um, and I'll briefly talk about too why this might be. So as you're listening to this, you might be thinking, I don't ever work with people impacted by incarceration, or I work with people all the time impacted by incarceration, or somewhere in the middle. What I want you to keep in mind is think about the people and the families you work with who have been impacted by, if not incarceration, something similar. So we're talking about separation and reunification, big family disruption. So that could be deployment, it could be foster care, um, other immigration, right? Especially right now, we've got a lot of families experiencing separation and maybe not reunification. And a lot of families impacted by incarceration also don't experience reunification. So no matter what your specific corner of this work looks like, think about how it might be applicable. Okay, so broken down a little bit more clearly, this is what we'll cover. I'm gonna give a brief overview on incarceration and families, what the ripple effects of incarceration is on families. So this is basically a state of the research. What do we know about this? I'll try to make it. I'm passionate about this, so hopefully you'll be engaging in that way and not super research boring. I'm also going to talk about the risk pathways. So how does incarceration amplify risks for families, especially substance use and behavioral health? Protective factors. So again, talking about pathways of resilience, and then implications for those of you who are on the ground doing this work, working with families face to face. Okay, so again, I mentioned incarceration, I think is a critical but overlooked social determinant of health. So I'm going to talk a little bit about that first before I get into practice, but I want to situate this presentation with a brief note on language and reflexivity. So let's see if I can, just want to bring everyone up. There we go. So I want you to raise your virtual hand, which I think I'll be able to see it here, if you think that the criminal legal system is broken. I see a lot of nodding heads, yes, a lot of hands going up, a lot of thumbs up. Okay. Yeah, I see everybody's boxes popping up as you weigh in. So I was asked this question when I went to a conference back in February or March of this year, the Academic Consortium for Criminal Justice Health. And the keynote speaker was Anthony Ray Hinton. I'll say more about him in a minute, but he asked us this question. Raise your hand if you think the system is broken. And every hand in the room went up. And he said, the system isn't broken. It's working exactly as designed. And you could sort of feel I think just the energy in the room, people saying, oh, okay, yes, I see why you asked that. And it was a really, it was kind of a profound moment for me because it sort of synthesized a lot of experiences that I've had as a practitioner, but also a lot of the research that exists on the criminal legal system. Now, Mr. Anthony Ray Hinton, he was wrongfully convicted in Alabama years ago. He spent 30 plus years on death row. And his story, I mean, it's very, very, very powerful. He's in the documentary with Brian Stevenson, Just Mercy. His story is really powerful, and he's not an anomaly, unfortunately. He is, I think, a victim of what happens to a lot of people in the carceral system. So, for example, he had investigators, detectives saying to him, even though he had an alibi, they said to him, Well, and he was a Black man, for context. They said to him, well, we don't care if it was you or not, one of you did it. So a lot of the systemic and institutional racism that sort of shapes the mass incarceral system shows up in these people's interactions and results in people like Anthony Ray Hinton being a victim of the system. So why do I mention that? Because the criminal justice system is not just for all. So I use the term criminal legal system. A lot of people in this work, in this space, use the term criminal legal system instead of criminal justice system, because the system is not just for all. It may be just for some, but it's certainly not for all, and partly due to the institutional and systemic racism that is embedded within the mass incarceration system. I also use language like person who is or person who was incarcerated instead of inmate or offender, because language matters. And historically, language has been weaponized to dehumanize and demoralize and marginalize people. So this is one sort of small act of resistance we can take when talking about this population. I also take a restorative justice approach to my work. So that means focusing on healing people who have been incarcerated. I sometimes get criticism around this, and people will push back and ask why, sort of my words, not theirs, but why I want to give offenders handouts or offer them a feel-good experience. And that really represents more of the punitive versus rehabilitative approach to the criminal legal system. But restorative justice tells us that actually, if we focus on healing people, it's a way to promote global healing, and we can prevent further victimization if we use restorative justice. So last note on here, I just want to mention my position and proximity to the work. I'm sure you all, as community providers in your different roles, think about your position and positionality to this work, but I hold profound privilege, not just as a white, highly educated woman, and I have never experienced the harm or constraints of the criminal legal system myself, and that feels really important to mention. I am committed to honoring those who have lived experience. I center their narratives when I can. I resist dehumanizing language, and I challenge some of the carceral logics. So these are my small acts of resistance. This feels important to spend time on, so I want to situate my work with these notes. Okay, so let's first talk about mass incarceration. Raise your hand. Well, some folks might still have hands raised, so I'm not going to. Okay, no, they're down now. Raise your hand if you've heard the term mass incarceration. I'm just curious. I'm sure many folks are familiar with it. I just want to get a sense. Okay, lots of folks are familiar with the term mass incarceration, so I won't spend too much time on it. We can trace it back. I mean, we can trace it back pretty far, actually. Policing itself began in the times of slavery as a way to hunt and capture people who had escaped enslavement. So it goes back fairly far. But if we come up sort of more recently, in the last 50 or so years, in the 1970s, politicians started to use fear in thinly and not so thinly veiled racial rhetoric. For example, law and order, that pushed really increasingly punitive sentencing policies. And then in the 80s, although Nixon started these trends by declaring a war on drugs and tough on crime initiatives, under the Reagan administration, these initiatives exploded. So communities of color were hit hardest due to criminalization of poverty. That's one of the biggest determinants of crime, and racially biased sentencing policies. And then in 1994, due to the 1994 crime bill, this was passed under the Clinton administration. This really it added fuel to the fire, if you will, of the mass incarceration problem by creating really tough new criminal sentences and incentivizing states to build more prisons. This is what started the privatization of the prison industrial complex, which I could spend a whole other presentation on. We started to see a peak in mass incarceration around 2008. So when I say mass incarceration, what I'm referring to is a 500% increase in incarceration rates between 1970 and the year 2000. It started to slow between 2000 and 2008 and peaked in 2008. as you can see in this timeline, we can largely attribute this to policy changes like the war on drugs, mandatory minimum sentences, three strikes laws, political campaigns that ran on law and order, tough on crime, etc. And these, like I said, these policies disproportionately targeted people of color, resulting in huge racial disparities among incarcerated people. So, for example, African American and Black men are incarcerated at more than 5 times the rate of white people in general, and are 6 times more likely to be incarcerated for felony drug convictions, despite both Black and African American and white people reporting similar rates of substance use. So that's where an example of where we can see that disparity. So where are we today, right now? So 2008 is where things peaked. We've slowly started to see that come down. Right now, about 1 in 36 people are incarcerated in the US. And to put this into a global context, I mean, we're still the world's leader in incarceration. Even though the US holds only 5% of the world's population, we house 21% of the world's incarcerated population. And 63% of those people identify as a parent. So you can see in this timeline, mass incarceration isn't just a period where we just started, really getting tough on crime, right? Like you can see sort of in every piece of this that there is institutional and systemic racism in terms of who we incarcerate and why. And so that brings to mind the question, what are we actually correcting in the correction system? Um, the correctional system can be viewed as a way of correcting people towards a sociocultural ideal. So I include this quote. This is from a qualitative article from a researcher, Dr. Burton, from 2021, who did a really powerful qualitative analysis and had participants' quotes. And I think this one is very powerful in terms of demonstrating sort of what are we actually correcting in correction. So I'll read it out. The bars, fences, walls, cages, kennels, and commands, the formal and informal techniques of coercion, isolation, and rehabilitative programming, the daily rituals of institutionalized dehumanization, all aim to domesticate and or break the target's spirit. For absolute, an imprisoned Black man, domestication occurs when the captive begins to accept the administration's view of their condition, to see themselves not as a casualty of an unjust war, but as a defective, valueless, polluted subject in need of the state's redemption and repair. I think this quote is really powerful because it shows how people can be dehumanized in the incarceration system. Now, why is that actually important to talk about in this context, the context of this presentation? Is because that's important to keep in mind when we're working with these people and these families, right? They aren't somebody who just committed a crime, served their sentence, and are out. That may be part of it, but the larger picture is that crime is shaped by forces around institutional and systemic racism, for example, criminalizing poverty, and incarceration itself can be quite traumatizing and dehumanizing, which is just really important as a frame in terms of the work that we do on a community level. So if we take all of that together, I guess the story that I'm really trying to drive home around the carceral state cycle is that we tend to see with the families we work with who have been impacted most by incarceration, this sort of existing social and economic policy forces that dictate material hardship, lower socioeconomic status, and poverty, which often will lead to segregation from society and institutional racism in the carceral system. And then when people come out of incarceration, back in order here. Okay. So let me talk a little bit about sort of what this looks like on a granular level. What you're looking at right now, the carceral state cycle, is really thinking about sort of how do people even come to encounter mass incarceration? What are the risk factors that get them there? How do different policies interact with that? And how does it shape worsened health and economic disparity? So I'm going to talk a little bit more on a granular level in terms of how this impacts families. So right now, 1 in 14 of all children have an incarcerated parent. That's a lot of kids. It translates to almost 2 million children impacted nationally. So thinking about those racial disparities that I mentioned, 1 in 9 Black and African American children currently have an incarcerated parent, and 1 in 8 children living in poverty have an incarcerated parent. So this does not impact all families equally, right? This impacts families of color, particularly Black and African American families, and families with lower socioeconomic status much more. And again, that could be in part representative of a broken system, but I think we can also argue this is representative of a system that's working by design, right? Further marginalization. Some of the experiences that families have, so one term is secondary prisonization. This refers to the experience of a loved one's incarceration, the effects of a loved one's incarceration on the family. So what this can look like, for example, is when family members go to visit their incarcerated loved one and get treated by correctional staff like they are an offender themselves. Um, you know, being subject to the same level of searches that somebody who's incarcerated might be subject to, not being allowed to touch children, touch one's own children, etc. Incarceration by design also results in interrupted relationships, maybe interrupted development, especially for kids and teens. Now, I do want to know, I'm sort of talking about this in a really broad way as if incarceration is detrimental to every family. By and large, it is, and the research supports that. There is a percentage of families that do benefit from this, right? So and I don't mean economically or anything like that, but sometimes when a parent goes to prison, it actually promotes safety in the family. So I'm not really going to be, that's a totally different, I think, experience in terms of working with those families. It is the exception, not the rule, but it does still feel important to name. These families also describe doing time on the outside. This is taken from a qualitative interview from a study by Joyce Arditi, doing time on the outside, right? Also being punished by proxy to what their loved one is being punished for. And then the experience of ambiguous loss. Ambiguous loss, if you're not familiar with that term, is when somebody is physically present, so physically alive, but psychologically absent. And the term ambiguous loss can be used, I think, in a number of different contexts, but it's particularly relevant for incarceration because your loved one is still alive, maybe nearby, maybe in another state, but psychologically absent from the family. And my dissertation chair used to say, when talking about stigma, nobody brings a casserole by for the prison widow. It's a different type of loss than most people, I think, know how to respond to. It's not a typical experience of grief, if you will. So families often don't talk about it. In terms of some of the risks that can happen, so health, we see significantly higher risk outcomes around physical and behavioral health in particular, especially for kids. Um, academic problems are a huge issue here too. Family instability and school mobility. So when a parent goes to prison, a lot of times the family socioeconomic status changes or the family has to move to be in closer proximity to their incarcerated loved one. So that means kids changing schools. Inequality, patterns of legal system involvement, and economic hardship can just, pre-exist incarceration and then be worsened by incarceration. And then, of course, stigma, like I mentioned, and some of the social support loss that can come with stigma. So that's sort of the context, the landscape of what families with an incarcerated loved one can experience and what can, I guess, shape or coalesce into incarceration itself. So let's talk a little bit about the risk pathways. We can't talk about resilience without also naming what are these families at higher risk for? How does incarceration foster substance use and behavioral health vulnerabilities in particular? As you can probably put together, or maybe with most families we work with, the answer is really complicated. Risk pathways are not linear. They're not incarceration equals vulnerabilities equals they come onto our caseload and we work with them. It's much more systemic than that. So if we look at what some of the actual determinants of crime are, they include socioeconomic status conditions such as poverty, unemployment, inequality, low education, family and social environment factors like family conflict or prior parental incarceration, neglect, peer influence, weak community ties. Some individual factors such as impulsivity, aggression, mental health and substance use, and then structural factors, like I had mentioned previously, so policing practices, legal system inequities, lack of social safety net, housing, healthcare, employment, those are all really big. And then situational opportunities, so weapons access, proximity to drug markets, absence of guardianship. So these are some of the biggest determinants based on best available research to what actually promotes crimes. But here's what's interesting. So, crime determinants, as we know, lead to crime and then incarceration, which further traumatizes people and then by extension families, which leads to worsened social and structural factors, which, by the way, those worsened social structural factors are the exact crime determinants that inform incarceration. So again, there's that cycle that I had started to describe earlier. This is what it really looks like from I think from a provider and community perspective. And so as sort of in terms of thinking about how we address this, one of the biggest ways we can address this is addressing those crime determinants. So socioeconomic status, families, individual factors, structural factors, etc. So this is what we're trying to interrupt, right? And you might be thinking, well, this is pretty terrible. What can we do? And unfortunately, policy is one answer because again, I'm just going to go back briefly. If you look at these major crime determinants here, what they all have in common is that they require policy solutions. Yes, there are things we can do at the community and individual level for each of these factors, but for these groups of crime determinants, major policy is needed to really address this at sort of a systemic level. But unfortunately, it's not great news with the state of policy. Um, there are some examples of things that are working. So community-based prevention programs are showing really good promise. For example, what's happening in Baltimore right now, the program and the mayor up there I point up there because they're directly north of me, but these programs have demonstrated significant drops in violent crime by involving people like us, social workers, outreach leaders, extension folks. In the Biden administration, the American Rescue Plan and Safer Communities Act actually had funding for these successful programs. So we started to sort of get on a track where we were going to be able to address this at a community level. However, the current Trump administration has rolled back a lot of funding for these programs, including eliminating $170 million in gun violence prevention grants and other community-based programs that address social and structural inequities. So we're sort of in this whiplash experience where one administration is providing funding for some of these programs, the next administration is rolling it back, which really doesn't give us a lot of time to make changes. The current administration really strongly emphasizes law and order by expanding policing, in particular through federal law enforcement. We're seeing that in DC right now and police departments. Also, this administration is promoting harsher sentencing policies, rolled back investment in community-based prevention strategies and public health-based approaches, and not just in terms of programming, but in terms of research as well. I will say one notable exception is the First Step Act, which was passed in 2018 under the first Trump administration and created some really helpful rehabilitation programming and created early release pathways. So that was legislation that had been in the works for a long time, was passed in the first administration, and then this most recent one has rolled back a lot of funding. At the state level, some states are enacting local reform to reduce bias and inequality and target prison reform. So, for example, Texas, Illinois, California are all states that are doing this, Maryland too. But at present, we can't really rely on federal policy to promote meaningful change because even if we do have federal policy that's promoting meaningful change, the next administration could roll it back or undo it. So here's what that means. Here's sort of one of the key takeaways for you in this is that change has to happen at the local level through professionals like you and the communities that we serve. That's where the long-term sustainable change is actually going to happen. So far, we've talked about factors associated with incarceration and risks of familial incarceration. So what might a returning citizen actually experience in reentry, and what, as local providers, might we see? Unemployment, stigma, housing issues, trauma, low social support, stress reactivity as a result of high cortisol and impulsivity, low coping, amplified pre-existing risk. So usually people who are incarcerated have on average much higher numbers around adverse childhood experiences, poverty, negative peer influence, stigma and exclusion, economic disadvantage. So I want you all to think in your roles, based on your experience, what are these things a recipe for? We know that they're connected to incarceration, but in terms of the work that you do, feel free to put some answers in the chat. What Yep, I'm starting to see. I'm also seeing some of the earlier comments. Thank you, Kristen, Brenda. disaster reentry, substance use and mental illness, return to use, recidivism, mental health and criminal activity, setting people up for failure, low self-worth, bullying in schools. Absolutely. It's a huge, I'm not touching too much on this, but bullying in schools is a huge experience, huge problem for kids with an incarcerated parent. Homelessness, stroke, yep, health challenges, housing challenges, families falling apart, addiction, self-harm, mental health. Yeah, yep. So you all are hitting that nail right on the head. This is a recipe for all of those things. What I'm zooming in on here is substance use and behavioral health risk. We know from the folks that we work with that all of those things on this previous slide are risk factors for substance use and mental health, but they are also what people in reentry tend to experience. So this is a really critical time, and it's why incarceration is such a critical determinant of social determinant of health. So briefly, here are some of the risks, as many of you named. High risk of relapse and overdose, so loss of, especially for people who are just reentering. If they, I mean, usually folks who are incarcerated can access substances illicitly, but oftentimes there is a loss of tolerance that happens during incarceration, which makes relapse particularly dangerous and at risk in reentry itself. Triggers and stressors of reentry, like housing, stigma, reconnecting with family. Limited access to treatment. Unfortunately, you know, in a lot of states, people are on Medicaid while incarcerated, but as soon as they leave, they're kicked off. Some states have a bridge program, but not all. Program shortages around community mental health and substance use treatment. And I'm sure we're all very well aware of the mental health and substance use national provider shortage that's happening. Co-occurring mental health needs, as some of you named, absolutely. We're also going to very likely see housing instability. I have a good friend of mine who's formerly incarcerated himself. I work really closely with him. He's worked at the ACLU in the sentencing project and is responsible for a lot of policy changes nationwide. And despite that, he still is unable to find reliable housing to rent in many places because of his criminal record. And that's somebody who has, you know, I think really achieved a lot for himself despite these barriers. And so the barriers to safe housing are very high among people who have a formal legal record. Family and relationship strain. We know that people reentering are probably going to experience stress, conflict, isolation. We know that substance use relapse can damage these relationships. And also, I recently did a qualitative study last year, and surprisingly to me, I guess not surprising from a practitioner perspective, but it was surprising to have this come up. A lot of folks said, yeah, my social support is wonderful, except they're using too. And so actually, I can't really rely on them because they're a trigger to me in terms of substance use. And then larger systemic issues that we've started to touch on. So barriers to jobs can of course increase financial stress. Probation and parole may punish people in relapse instead of actually treating it. And then stigma can be a barrier to accessing treatment. So this is all terrible. It's not great. We know the risks are really high. We know that there's a lot of intersecting risk that happens leading up to incarceration. Incarceration makes it worse. And that leads often to reincarceration. I think the statistics are 68, this is off the top of my head, 68% of people who are released from prison are rearrested within 3 years, and then 77% are rearrested within 5 years. So we have staggeringly high reincarceration rates. So what can we actually do about it? Like I said, the impact is at the local level. It's at the community and provider level. So let's talk about some protective factors within families experiencing incarceration. So these are factors that are evidence-based, things that we can rely on and amplify to promote better reentry scenarios. I want to really drive home that incarceration, yes, it does create profound challenges, and we have to honor that. We can't be sort of all optimistic, everything will be fine if you think it's going to be fine. It does have profound challenges, and it does not erase families' capacity for resilience. These things do happen at the same time. Families often demonstrate profound creativity, adaptability, and resourcefulness in ways that go unnoticed, and we can notice them. So based on the research, this is what we know promotes well-being among families impacted by incarceration. And again, think about the families you work with that maybe haven't experienced incarceration, but do experience some of these other social and structural determinants of adversity, or maybe separation and reunification experiences. So first, kinship, social, and community support. So social support across friends, family, community to assist with financial, instrumental, like driving somebody to work, and relational needs during incarceration and reentry. One piece I want to note on this, I had mentioned the interviews that I had done recently, and one of the main takeaways from that research project around social support for me was that not all social support is the same. And of course, I think as providers, we know that, right? But especially for this population, one of my takeaways was that it's not just the presence of social support that matters, it's the quality of it. And so as we are working with families, as programs are interacting with families, we need to consider social support not as a checkbox. Do they have it or do they not have it? What is the quality of social support and community support that these folks have? For example, are family and friends supportive of sobriety, or are they also using? Can these people provide support in different ways, creative ways? If it's not financial support, could it be instrumental support, driving somebody to a doctor appointment, et cetera? So really assessing sort of the quality of social support. Behavioral health, this is kind of a no-brainer, but it's still worth talking about. This is a really critical resilience process, especially within families. The partner who's not incarcerated, um, again, I'm going to be talking off the top of my head, but I think the statistics are in terms of heterosexual families, when a male partner is incarcerated, about 90% of the time the kids stay with the mother. But when the female partner or the mom is incarcerated, I think it's only around 30% of the time they stay with the father. Most often they go to a maternal grandmother. So that's why I use the word partner, but really I'm talking about caregivers of kids or people who are stepping in to support the family. Research is really clear. When we support the mental health of the caregivers who are not incarcerated, outcomes are much better for not just the kids, but the caregivers themselves. This is what my dissertation work was around. Um, so we want to focus on promoting coping strategies to manage stress, uncertainty, make sure people are doing the really basic things to take care of themselves. I was really humbled earlier this year when my husband was really ill and was hospitalized for almost a month. Certainly not the same experience as parental incarceration, but I was managing that, had an 18-month-old, and I was humbled. I remember feeling like, wow, it really is hard to just take care of yourself in really basic ways when you're going through something really hard and support isn't right around you. Family live far away. So remember, this is much easier said than done, and we have to work really concertedly and thoughtfully with families to make sure that they're prioritizing the behavioral health of the people who are supporting the backbone of the family, if you will, while somebody's incarcerated. Cultural identity and traditions, faith and spirituality, this is huge. Faith and spirituality can be a wonderful resource for families. Positive peer networks of support groups for youth and caregivers, traditions, inquiring and amplifying about storytelling, music, food rituals that reinforce belonging, etc. Parenting. So parenting practices very clearly are critical resilience um, factors, there we go, that can promote social emotional health and positive adjustment for youth. So we're talking about promoting strong attachment bonds, healthy, safe parenting. So this is not just, we don't want to just focus on parenting for the caregiver. We want to focus on parenting as it relates to really strong mental health, taking care of themselves, and how good parenting, healthy parenting can come a little bit more naturally when we're taking care of ourselves. Relationships, research shows that romantic relationships can promote resilience and reentry only when the relationship quality is high. The research around this is very interesting. So actually, people who are in a committed romantic partnership are twice as likely to be reincarcerated. So those who are I'm just going to repeat that because it's very interesting. Those who are coming out of a carceral setting and are in a relationship are twice as likely to be reincarcerated. However, that association is flipped. It becomes significantly less high when the relationship quality is strong. And like I said earlier, there are currently no evidence-based couples reentry programs. I am trying to develop one. But what that means, as for those of us doing the work on the ground, is that when we focus on the quality of the romantic relationship, we can actually promote much better reentry outcomes. And then finally, systemic factors. So case management, resource connection is critical. People need resources to bolster economic security, food access, employment support, community ties, parenting, behavioral health, etc. So I'm sure you're maybe thinking, okay, yes, we know all these things are important. Yeah. But how do we actually amplify these resilience pathways? So first, I'm going to briefly talk about how we can show up sort of when we're working with families one-on-one in a day-to-day basis. So think of this as the individual support, working with individual families. But I also want to recognize many of you work at a programmatic level or community level. And so then I'm going to talk about how your program or system can think about how to better support these families. So let's take a moment to talk about trauma-informed care. So very briefly, trauma-informed care was developed in response to some pretty unfortunate practices in behavioral health where people were being actively re-traumatized in behavioral health settings. So we're talking, pre kind of, well, I guess probably pre-1990s. So for example, putting people in constraints, right? That could be re-traumatizing to folks. And this was a initiative led by SAMHSA, the Substance Abuse and Mental Health Services Administration, led a program to develop trauma-informed principles so that we as care providers were actively not re-traumatizing people in the work that we do. This is really important for incarceration because incarceration itself is often a trauma, not only for the incarcerated individual, but as some folks mentioned in the chat, also for their partners, children, and extended family. And families might show signs of hypervigilance, shame, mistrust of symptoms, withdrawal, or high stress. And here's why I want to mention the experience of policing and community supervision, probation, parole after reentry. The hypervigilance is real for a lot of these families because they quite literally are being monitored and surveilled. This could, I think, is also applied, especially right now, for families with different migration or documentation statuses. The hypervigilance can be really high, and understandably so. So without a trauma-informed approach, of course, service providers, we risk unintentionally re-traumatizing families through stigmatizing language or judgmental questioning.
Amy, you
Yes,
have about 13 minutes left.
thank you very much. I appreciate that. Thanks, Jade.
No problem.
Okay. And I'm just looking at catching up on the chat. Yes, I will be sharing my slides. So if I'm going quickly through anything, you will have access to all of this, including some resources that I'm going to link for you. So what does our trauma-informed care look like? Trauma-informed care very broadly, trauma-informed care from SAMHSA, they love their like acronyms and, it's easy. These mnemonic devices are easier for us to remember. So trauma-informed care from SAMHSA has 4 R's. They are realizing the widespread impact of trauma, so incarceration is a trauma for the whole system, recognizing the signs of trauma, withdrawal, shame, mistrust, etc., responding with practices that promote safety, trust, and collaboration. This is huge. Safety, trust, and collaboration, and resisting re-traumatization. For example, avoiding stigmatizing questions like, well, what did they do? Why were they incarcerated? Is that really critical to the work that we're doing? That's what you want to think about. And then the trauma-informed care principles, so there's 6 of them. These are the principles that we can embody as trauma-informed providers. So just a brief clarification, trauma-informed care is not sort of a therapy model, but it's just a way of being. So at the community mental health agency I used to work at, actually everybody was trained in trauma-informed care, not just the clinicians, but the front desk staff, the custodial workers, et cetera, so that we made sure that anytime somebody was interacting with a client, that we were promoting them, approaching our interactions with them from this perspective. So think about safety, not just emotional safety, but physical safety. I'll give you a really brief example of this. Somebody who's been incarcerated likely might be a little triggered around feeling like they can't get out of a room. So think about where your chair is in a room compared to where their chair is. Just a really quick, simple example. Trustworthy and transparency, be clear about program goals, limits of confidentiality, what families can expect. We don't want to blindside people because the criminal legal system often blindsides people in really illogical ways too. Peer support. So there's a lot of research around how certified peer support specialists actually are one of the biggest, most effective tools, as effective as mental health providers, like master's level mental health providers, in supporting people who have experienced incarceration, because that key is lived experience. So there are, if you just search for certified peer support specialists in your area, sometimes they are referred to forensic peer support specialists who have specific experience with the criminal legal system. And I believe 48 states Now, Medicaid now actually reimburses for peer support specialists. Yeah, I think it's 48 states. It might be higher now. Collaboration and mutuality. You want to frame families as partners, not passive recipients, not as people in your, you want to really reduce the power differential as much as possible, because anybody in the criminal legal system, all they know is somebody having power over them. Empowerment, voice, and choice, asking families what matters to them, let them set goals, give them a voice, and then cultural, historical, and gender issues, recognizing how systemic racism, intergenerational trauma, and stigma intersect with incarceration. At least just being aware of those things and those experiences can help demonstrate that you are somebody who is broadly aware of what their experiences might be. So some strength-based approaches, we want to reframe families as resourceful and resilient, not deficient. We're not working with broken families. We're working with families who have navigated a lot of adversity. Use language of possibility, like what's working well for your family right now. Highlight those protective factors, kinship ties, community networks, cultural strengths, faith traditions. Shift language to be more strength-based. Instead of family dysfunction, use the term family-facing separation. Compassionate validation. You can acknowledge the challenges. Acknowledging the challenges can be really powerful. For example, saying it makes sense that this feels both hopeful and scary that he will be home this time next week. Be an advocate. Systems often don't talk to each other well, and facilitate collaboration with them to reduce how much systems are siloed as much as possible. Again, shifting from a deficit lens to a resilience lens. So examples of strength-based questions and affirmative statements might be, what has helped your family stay connected through this time? What's already working well that we can build on? It sounds like you have found really creative ways to stay connected as a family. Your ability to keep routines going shows real strength. What's something your kids are doing that you're proud of? How can we build on the support that you have, et cetera? So you can see where a lot of these questions and statements are really trying to honor existing strength and build on them. So those are a lot of the individual based implications that you can use if you're working with folks one-on-one. But let's zoom out and talk a little bit about program level and systemic implications. So from the get-go, screening and awareness. If you have the opportunity to screen for this, you might be surprised by how many people actually are impacted by familial incarceration. So consider incorporating questions about this into intake forms. Has a loved one ever been incarcerated? Ensure that that screening is done with sensitivity and confidentiality. Think about adapting any program curriculum, for example, tailoring curricula to acknowledge family separation. So, for example, parenting programs that address co-parenting across distance. Again, it doesn't have to be specific to incarceration, but maybe you've got folks that are working, opposite shifts, or parents live differently in different settings, incarceration, immigration, foster care, et cetera. Provide space for children to actually talk about incarceration without stigma in prevention settings. Embed resilience building activities, journaling, storytelling, really tap into those cultural rituals, people's cultural traditions and ancestral knowledge of healing and promoting resilience can be a wonderfully untapped resource. Thinking about prevention strategies, build some protective factors in community settings. So we're talking mentoring programs, especially for youth, support groups for caregivers, that's critical. We talked about the importance of caregiver mental health, youth leadership opportunities. There's a lot of research to show that when youth are involved in leadership, it can break intergenerational cycles of incarceration. Collaborating with schools to recognize the hidden impacts of incarceration on children's learning and behavior. There can be a really big impact. I know a few of you are working in schools. So not just in terms of academic outcomes, but what the literature calls antisocial behavior, being bullied, et cetera. So working with schools to recognize these hidden impacts and trying to address them can be really critical. Treatment program consideration. So train staff in trauma-informed care and implicit bias related to the criminal legal system. At the end of this, I'm going to link a free manual from SAMHSA on trauma-informed care. It is so, so, so helpful. I wore mine so thin. I had a physical copy. I wore mine so thin I can't even use it anymore. And I have the digital one that I bring up all the time. Offer family-inclusive substance use treatment when possible, rather than siloed individual models. Getting the romantic partner and the family involved as much as possible can promote better outcomes and promote some of that relational healing. Build reentry prevention bridges. So this is where you can coordinate with probation and parole, reentry services, and community health providers. Again, it's breaking down those individual silos and really trying to foster collaboration and mutuality with everyone that's serving the family. Some program level reflection questions. So if you are somebody who is working in a program or has some sort of decision-making power in a program or can bring this conversation to your leaders, these are some questions that I want you to take away. And this is my last slide before I get to Q&A and resources. So does your program ask about incarceration at intake? Where in your programming could you create a safe space for children to process stigma, to at least acknowledge stigma, not feel so alone? What protective factors are you already strengthening, and how might you name them more explicitly with the people that you serve? Are your treatment approaches inclusive of families or primarily individually focused? And if your program does not work with many families impacted by incarceration, how can you integrate these approaches, these tips to families impacted by structural disadvantage and or separation and reunification, like I said, deployment, immigration, foster care, etc. So thank you very much for your time. This is essentially an entire undergraduate course slash master's level course that I could teach at UMD in 45 minutes. So I've linked my presentation here because I went through a lot of information. I want to make sure that you have a lot of information you can refer to later. So there's the link, go.umd.edu/incarceration. You can access it via the QR code. And these are all wonderful resources I'm linking here. So for those of you working with kids, young kids, the Sesame Street and Communities link, Sesame Street partnered with PBS to develop this programming specifically for kids impacted by parental incarceration. It's a wonderful resource. The rest of these are just a lot of different, reentry, family-focused resources. It looks like people need access.
I will take, Amy, if you just send this to me afterwards,
Yep.
I'll be able to take this. I'll take everything from the presentation and I'll send a follow-up email to everybody.
Okay.
I have put in our survey that we have. I see that you put a QR code. Do you have a link to the survey as well you want to put in the chat? If not, just make sure you send everything to me.
You know what I can do right now? I'm just going to drop the PDF in the chat and then I will also send it to you. So for those that are still here and for whatever reason can't get access to it, I'm going to drop the PDF in the chat now and then I will also email everything to you, Jade.
No problem, thank you. So I'll make sure that I email out the presentation, all of the resources that Amy has provided, our program packet, because we have a bunch of additional programs that we offer trainings, virtual and in person. Um, and I'll also make sure to include the Eventbrite link for our future public events. I just want to say thank you, Amy, so much for this presentation. It was very informative and definitely builds upon all of the work that Rota is doing, especially with the Family Sciences program. So thank you very much.
Yeah, my pleasure. My pleasure. And I will be dropping that link in the chat momentarily, but I've got it looks like 3 minutes. If anybody has any questions, again, I apologize for rushing through so much information, but in making this available to you, I wanted to make sure I was able to give you as much as possible that you could access later. All right.
And if you have any follow-up questions, I'll also put my email in the chat. You can also respond to the Eventbrite if you are not able to get that, and we'll be able to make sure that you get access. I see some people are having access difficulties with the links provided for Amy's presentation. That's okay. As soon as we drop from here, I'll go and compile all of the information and I will be able to share that, both
Yep.
what she provided in the presentation as well as the presentation itself.
I'm about to put this in the chat. It just finished downloading. So hopefully Zoom doesn't give me a hard time. Let's see. Do you provide training for currently incarcerated adults? I think is what the question. I'm doing two things at once. Do you provide training for currently incarcerated adults? While I'm in contact with currently incarcerated adults, I guess I do provide some programming. I'm going to put my email in the chat. Feel free to reach out to me and we can talk more about your question, see if I can't answer it a little bit better. The file is uploading into the chat, it's just a big PDF, so it's taking a minute. Do you know of any good programs designed to help families stay connected while a parent is incarcerated? So that's a great question, not off the top of my head, and here's why. Hi, Ali, good to see you. Here's why, because contact and visiting can really depend not just on state, but on jail to prison contacts. But I will tell you in sort of 30 seconds or less, the research is really clear that the more consistent communication that kids and family members have with their incarcerated loved one, caveat, as long as the visitation is not traumatizing itself, promotes good, healthy relationships in reentry. So if you can work with families to identify ways that they can stay connected, even if that means somebody's writing letters to a loved one that that person won't receive for a while, but they can save them. That's all going to, I think, serve relationships well. Looks like my PDF is struggling to upload all the way. So Jade, I will make sure that you have everything so that you can email out resources to folks. Sorry that link didn't work for some people.
No problem. I have everyone's email as long as you signed up on Eventbrite. If not, I've put my email in the chat. You can always reach out to us, or the Maryland wrote the email, and I'll be able to assist you with that as well.
Yes, thank you.
I
Please reach out if
always
you have any questions or feedback or you want to talk more. I'd love to connect with you all. Thanks for this opportunity.
Thank you.
Thank
And
you.
definitely check out our program offerings because we have additional programs such as mental health first aid, adverse childhood experiences, a lot of courses that will help provide additional information to support the wonderful training that Amy gave today.
Thanks,
Thank you,
everyone.
Amy.
Thank you so much.
All right. Thank you, everyone. You can go ahead and log off. If you have any additional questions, I'll still be here.
Okay.
Okay, Jade, I'm going to email that to you right now.